Hello, we're going to go over prescriptions and labels briefly. We're going to basically, it's just a recap of what you know from Dosage Cal, but it is just knowing that your terms and your objectives. You want to definitely discuss the precautions and ensure the patient's safety, identify the parts of the legal prescription, and just differentiate among the different types of medication orders, list which healthcare providers are able to write prescriptions, define abbreviations used in prescriptions, interpret label safety, and then discuss the impact of e-prescribing on healthcare consumers. So, and of course, you always have to look at medication orders. With those medication orders, you have to double check. You have to know the patient history. You definitely want to know if that's going to interact with any other medications that they're on. And when you confirm the prescription with the pharmacist and they send it up, make sure that is the correct prescription, because like we had talked about previously, there are a lot of medications that look alike or sound alike, but there are labels that are usually that are could cause death. They'll have a double label on it, or sometimes a black label. Written orders, which you thank God there's not that many written orders anymore. There's mostly on the MAR, or the MAC, where they actually have to put in the order on the computer. So there's less likely problems, but you definitely want to check that, because especially for the older doctors that aren't computer savvy, they may have pressed the wrong administration process. If it's supposed to be oral, make sure it's oral, and but look at table 5.1 and you'll see the different abbreviations. If they're written orders, then you want to confirm that. And then if you have any question, call the doctor and make sure that you verify that order and state it in your notes, nurse's notes, that you have done that. Because if you haven't done that and something happens, and you did state you called the doctor and they verified it and said to give that dose anyway, and you do that, you will more than likely help you be not liable in the court system. But remember, if you have a stat order, that means now, and if it's an X-ray, if it's anything, it's stat. And so therefore, especially in the emergency room, they will have a stat order. And most of the emergency room, OR, and labor and delivery, usually you can override the Omnicell or Pyxis, but then there's a repercussion for that if you actually pick the wrong med, and that was an example in the Vanderbilt case. The quantity prescription dispense is limited to the required for the emergency period. There will be a flag that is sent to the pharmacist. There is just within 7 days of authorizing an emergency oral prescription, the individual will have a written prescription for emergency quantity delivered and dispensed, the pharmacist including. So electronic prescriptions orders, they have gone to that mainly. They send e-script straight to the pharmacy, but sometimes there's issues with those electronics and they won't receive it. So you have to call the physician and verify that and make sure that it has been delivered. if you're in a doctor's office. Standing orders, there's usually protocols. One doctor might want a particular standing order. Say, for instance, as you're in labor and delivery and they're all going to augment a delivery, they have a low dose Pitocin on a high dose rate. Depending on the doctor, you will follow those guidelines. That daughter, and then if they go back and they're going to have surgery, anesthesia is going to have an order. So you always follow those orders. And if you ever have a question, you make sure you call that physician and verify. And if they are having breakthrough pain, different things like that, especially post-surgery, and when they're still under anesthesia care. And usually anesthesia care is, depending on the facility, can be from 12 to, can be from 2 hours to 18 hours, depend on the facility and their policy. Then you always want to look at the parts of the prescription and the date or time. Always look at that, especially if you're home health and you're verifying medications for their home. Then just read through that, look at 5.2. And then subscription refills, you want to be allowed before the patient's return to the office. Some actually have to return to the office for a written prescription. Some you can actually send over, but certain like controlled substances now, they have to pick up the prescription and it has to be submitted within 7 days or it's voided. Now, look at over the critical thinkings. Those are important that you want to learn and make sure because, med errors are a big thing. Then you have the manufacturer labels that you're going to put on the side, make any kind of warnings or, and make sure that big thing, they don't contraindicate with the medicine that they use. And then you'll have, going to the end of this chapter, you'll see warning labels, the manufacturer, refill information, prescription name, expiration date, and then you just want to look at a fast tip. Those label warnings are supposed to be posted on the script. If it's not, you check with the pharmacist because if you're working in a facility, you're not having to do this, but if you're ever in home health, you want to double check and see if those are for those patients that may be cognitively compromised. Or even if they're mothers and they have kids running around, make sure that you're reinforcing that those drugs are behind a locked door. Then you'll have the trade name and then the generic name. So just look at all the labels. These are just pretty redundant for what you've learned before. You want to go over and just know these things. And that is it for today. And this is for prescriptions and labels. If you have any questions, let me know.